As we have very much paucity of the time, I'll just request our Dr. Joy Gopal Agrawal.
नहीं,
No, Dr. Jayanta Das, he
he
is
has got
there
an
next,
instruction
but he
code.
is in another
If
session.
he comes back, then he'll
If
give
he
a
comes in
present.
time, he will be there.
चलो हम लोग
Yeah,
इसीलिए
because we have to leave the hall at 11 now, because second persons will be there.
So we have already
Our
calculated
topic
time.
is Chat GPT versus Bing AI versus BARD, recent paradigm shift of application of AI. This time, all artificial intelligence are flourishing.
Yeah.
So let's see.
क्या बोलता जय गोपाल समझ में आई बोल ठीक से बोल
What I am saying, artificial intelligence is flushing in AIOC this time. Let's see.
It's flying all over the place. I mean, it's a good thing. This is a new concept. It's a good, yeah, it's a very good thing. Especially what I have seen in glaucoma and all. It's a very good tool. It gives a very good direction. Yeah, diabetic retinopathy, because I am not a retina person. Those people can, but glaucoma I can vouch for. Okay, it is a very good tool. Before it's time, I mean, like just like we are using it for a very long time, everybody will agree to the fact that perimetry, we have a stat pack analysis. That is also basically based on artificial intelligence. And a normative data which is being compared to your present data and then giving you as to what is going to happen. Yeah. So,
Okay. Good morning to everybody, my senior colleagues. My topic is recent paradigm shift of application of artificial intelligence in ophthalmology. These are Chat GPT, Bing Artificial Intelligence, and the BARD. All of you know that artificial intelligence, and it is a very common topic of the day. Since 2015, significant process has been made in the application of artificial intelligence and deep learning in ophthalmology. Deep learning is widely used to detect the wide range of diseases by image recognition using various types of ophthalmic data, such as fundus photographs and OCT. Here, what has been is done in the artificial intelligence. We have collected lakhs of data from the experts, and it is in the actually it is in the cloud form in the space, and artificial intelligence finds the distinct pattern in the randomly cloud of data points already created by large number of cases, and whatever we put the data in that, they just match to that already clouded in the space. That artificial works on the basis of pattern recognition of the stored data. Now, this is just a diagrammatic presentation of how artificial intelligence works. We collect the data pictures and we upload these pictures and data, and artificial intelligence, after proper level of investigation, it gives the results very clearly, and it is almost 90 to 95% correct. Now, imagine now what is now common to the world where the patient will self-diagnose their medical condition based on the self-reported symptoms and images. And we doctor will manage any medical diseases without prior domain-specific knowledge. Orthopedic surgeon can go for the ophthalmology in this case, and ophthalmologist can go to any other faculties with the help of this. Medical administration work, which is not interesting, such as drafting hospital discharge letters, will be done automatically. All above scenarios, once thought to be idealistic aspiration, are now gradually translating into the realities. It is possible by artificial intelligence, particularly with the recent arrival of ChatGPT. Now, ChatGPT is like Aladdin ka chirag. Now you will order, he will receive the order, and then he will put the answer to you in the written platform. Now, ChatGPT is the solution, where the ChatGPT is like calling artificial intelligence through human language, just like in Hindi, English, Bengali, and any other language. And artificial intelligence arrived to help you, just like in this picture. So it is a chat box where user interact with the artificial intelligence chat box, not a live agent. How GPT works? Chat GPT is an artificial intelligence tool with deep learning which understand and interact with the human language. What we ask them, it will in the voice may in the artificial intelligence chat GPT receive it and use the deep learning to complete the process. So we connect ourselves to big data of artificial intelligence cloud through chat GPT using human language. So chat GPT or Bing or everything is that it is fills the gap between the doctors and the artificial intelligence. We just command and they will reply. In artificial intelligence, previously we have to upload the data and they will send the any message with the pattern recognition. But here we can directly talk to the artificial intelligence through this chat GPT. Thus, ChatGPT allows to understand and respond to the human expectation when answering the questions. Thus, it can be called generative pre-trained transformer architecture. Generative means it creates new human-like contents. Pre-trained means models contains pre-trained vast amount of multimodal data, and transformer is a question goes through the series of transfer learning and to get the meaningful text data. But due to astounding versatility and function, ChatGPT has permeated in all fields, encompassing the business, entertainment, education, science, legal, and health structure. Now, it is when we started from 2018, and 2019 there's another software has come. In 2020 is another. Now, ChatGPT 3.5 come in the November 2022, and the legacy model in 2023 again. But shortly after, the ChatGPT Plus, it is a subscription based. We have to pay that for these services. So now it is widely used in all over the world. Now, another role of artificial intelligence, generative artificial intelligence, and the chat GPT and ophthalmology. We have patient's perspective, health professional systems, research, and education training. Now, patient perspective, virtual assistant for self-triaging and self-diagnosing. It is a very satisfying to the patient. It helps for the non-medical trained persons and patient for his ophthalmic condition. The virtual therapist for the patient education and counseling. The patient can generate education material from the simplified language, even easy for the layperson. You can ask the artificial intelligence through this chat box and they will answer. And it acts as a therapist for the counseling individuals with chronic eye diseases and visual impairment that gives mental agony to the patient. Suppose the patient is mentally very hard due to the visual impairment, they can get the advice from through the chat GPT, and chat GPT will answer through the artificial intelligence. Helpful being the multilingual means you can use any language. It can be text to speech. It is when the patient is visually impaired, you can text the message in the speech form and they will answer. Now, text to image means video generated platform when the patient will get experience through the video. Now, healthcare professional system, here again they synthesize a very diverse source of information of enhanced clinical management by formulating different diagnosis, decision making, and treatment plans. Assist the medical administrative tasks also, that is doctoring, discharge, this thing, and processing vast clinical information stored with the electronic health record. It is capable of generating concise, summarized patient record. Okay. Now, for the research work, it gives a wonderful instrument for those who are in the research work, for literature review, abstract manipulation, and debugging codes and the patient requirement. This raises the ethical debate whether the generative artificial intelligence or chat GPT should be recognized as an author in the research article. Based on the ICMJME criteria, the artificial chat GPT should not be included as an author due to lack of ability to approve and final manuscript to take the accountability of the research. Nevertheless, generative artificial intelligence assistance should be acknowledged in the publication. This is educational material. Again, you can ask and they will give the answer. Now, there are many types of chat GPT available in the form. That's in the OpenAI, Microsoft Bing, and the Google's BARD. Now, this is there's some difference. Google BARD is the real-time information has become. If I ask, then Google BARD gives the real-time information. But the chat GPT gives the on data up to the 2021. Now, here is the interesting. When you ask the chat GPT, just here I am asking here.
Dr. Agrawal, we have to hand over time.
Just I am asking,
11
what
o'clock.
is the recent
Yeah.
treatment of uveitis? Just see. नहीं चल रहा है.
Just briefly sum up what you want to say, what you want to convey.
Yes. Now, this will come in this way. Now, whatever knowledge you get, you can get it very easily. See, if we add in the BARD platform, if we ask some questions, it will be again. It is not moving actually. Yes.
नहीं सुन लिया अग्रवाल हैंड ओवर करना है. We have to
Yes,
hand
yes,
over
yes.
hall at 11 o'clock sharp.
No.
Take home,
Yes. No, 1 or 2 minutes.
No, it's already crossed.
Generative artificial intelligence involving revolutionize the ophthalmology. It is, as I have already narrated everything, what is the merit, and now what is the pitfall. It inaccurate response through the great appears great. When and it knows it is known as hallucination and fabrication. Thus, we can land it in the false position. And lack of recent knowledge, such as chat GPT model, was trained to September 2021, but BARD has no limitation. In this way, I am just, it is for the chat GPT, how much it has even come up in throughout the world. As you know, that 31% of doctors throughout the world are using this. Now, the time is coming when the maximum pitfall will overcome, and the chat GPT, along with the Bing artificial intelligence and BARD, will celebrate for the herald of dawn of new era of ophthalmology. We will have the bright future ahead. Thank you.
Thank you. Thank you, Dr. Gopal Agrawal, to give a very foresight what is coming up. Okay. Anyhow, just a concluding. Thank you.